We're going to be focusing on female pelvic health. Why? Well, for two reasons. One is that I still find that there is not enough practitioners who know how to work on these kind of cases. People mention that they want to be able to help their patients, but they don't really know how. And then on the other hand, I get a lot of prospective patients that are still reaching out to me looking for somebody in their area who can help them with various types of female pelvic complaints related to things like urinary incontinence or different uterine dysfunctions. Now, of course, training in this area and working with female patients with uterine problems and with pelvic problems is not for everyone. It requires a really professional and empathetic bedside manner. And it also requires some really good knowledge so that you understand how the female pelvis works, the visceral principles behind it from a lymphatic and vascular viewpoint, not just from a biomechanical viewpoint. And lastly, you need to be able to perfect your palpation skills, very refined skills, feeling for and manipulating and mobilizing and bringing back life and vitality to the organs in that area is very different from the structural approach that you might take with your standard osteopathic complaints. But if this is something that sounds like it appeals to you, maybe you know some patients who could use the help. Maybe you've seen people in your entourage who have had female pelvic complaints, or maybe you yourself are a female practitioner and who knows what it's like to suffer. So maybe you feel a calling. And if you do, our next course is going to be starting treating female pelvic complaints through the urogenital system, focusing mainly on bladder and uterine dysfunctions.